of Carondelet, Guardian Angels Parish, and Lumen Christi Catholic Community. So I am going to get us started for our opening prayer. We have one of those board members that I talked to you about. I'd like to ask Rabbi Jill Crimmings, who's not only a rabbi at Beth Shalom, but she's also one of the co-chairs of the Minnesota Rabbinical Association. And so Rabbi Crimmings, would you start us for the evening? Thanks.
Thank you so much, Anne. It is such an honor to join together with everyone this evening as we're doing this sacred work together. The theme of this evening's program, as Anne mentioned, is from Isaiah chapter 1, verse 17, inspiring us to make justice our aim. In Hebrew, the verse reads, Dirshu Mishpat. And the word Dirshu literally means you all must seek out. It's written in the imperative, and it's a command to us to not only choose justice when we are confronted by situations that threaten the dignity of our own lives or the lives of those that surround us, but rather it says that we should seek out justice, that we need to take active steps to step beyond the things that happen to us and those in our inner orbit. We need to make ourselves vulnerable to the injustices that we have not yet even uncovered. Everyone who is present this evening has taken the first steps in fulfilling this obligation. There are so many things that we each could be doing on this beautiful Thursday evening, but by signing on tonight, we have made an active choice to not just choose justice when it is confronted to us, but to seek out justice in ways that we don't even know are possible yet. And so I pray that throughout our time together this evening, we will be inspired to consider how we might be God's partner in actively seeking out justice. May we each find blessing and strength by coming together as a united Minnesota faith community, together as we all say, Amen.
Thank you. Thank you so much. That was beautiful. Our keynote speaker, we're going to jump right in. Our keynote speaker is Reverend Paul Slack, and I'll tell you a little bit, have a little bit of background on him, but I'm mostly going to talk about how I know him from working with him. So one of the wonderful things about my work is getting to work with some wonderfully remarkable people. Most of our work is done in coalition, and Reverend Slack is a common participant in many of the tables where the JRLC sits, the Homes for All Coalition, the Minnesota Asset Building Coalition. And he is a very good constant reminder of things we need to do better. He served in pastoral ministry for over 30 years in several regions of the United States. He's a pastor and founder of New Creation Church. He was a leader, co-chair, and president of Isaiah's board of directors. And when he was there, he established a racial justice table. He's done a great amount of work on really trying to understand structural racism, talking with elected officials, along with other people, and really trying to create a willingness to acknowledge and talk about race and explore the harmful structural realities that we live in every day. He's currently the social justice advocate for Lutheran Social Service. So he's working on their policy priorities, building and sustaining collaborations, but also having all kinds of conversations in the context of individual meetings or public meetings or political forums, town halls, and in many churches. I can share that he has a BA from Point Loma Nazarene College and a Master's of Divinity from Andover Newton Theological Seminary. But really what I want to share is that Paul is a present day prophet. So we have our words from Isaiah. I want you to think of Paul in the same way. He's an articulate and passionate voice for all Minnesotans, especially Black, Indigenous, and other Minnesotans of color. Isaiah calls us to make justice our aim. Paul would do the same thing, but he would also make sure that part of that needs to involve listening and reflection, but that listening and learning and reflection aren't enough. That's part of what we need to do, but that's not all that we need to do. I know he'll leave you with a great deal to think about after this evening is over. It's my pleasure to turn things over to my colleague, Reverend Paul Slack. Thank you, Paul.
Thank you, Ann, for those kind words of introduction. And also, I want to thank Rabbi Crimmings for such a powerful prayer. You know, you must seek out justice. If we can remember that, I think we win this evening. So glad to be with you all. I am going to read a small passage from another Isaiah passage, Isaiah 61, as I begin this message. The Spirit of the Sovereign Lord is on me because the Lord has anointed me to proclaim good news to the poor. He sent me to bind up the broken heart, to proclaim freedom for the captives and release from darkness for the prisoners, to proclaim the year of the Lord's favor and the day of vengeance of our God, to comfort all who mourn and provide for those who grieve in Zion, to bestow on them a crown of beauty instead of ashes, the oil of joy instead of mourning, and a garment of praise instead of a spirit of despair. They will be called oaks of righteousness, a planting of the Lord for the display of his splendor. Isaiah 61 is a troubling passage because it finds God's people out of balance with their covenant relationship and in need of a do-over. Troubling because suffering is all around. The rich are doing better than the poor, and the powerful are taking advantage of the disenfranchised. Troubling because of the reality of their circumstances politically and spiritually, and yet hopeful because God is predicting an epiphany, that is, an extraordinary sighting and experience of the divine that will provide refreshing and healing. In Luke, when Jesus embodies the spirit of this passage, the world was facing yet another troubling time: suffering, abuse of power, political and spiritual malpractice. We here in Minnesota are, I believe, in a similar time. Yes, again, a troubling time. Many are hearing that same passage, Isaiah 61, in the same way as Jesus as a call to action. The Spirit of the Lord is on me because the Lord has anointed me. Which me? I want to challenge what Ann said. She called me a present day prophet. By the time I'm finished, I'm hoping that that's not just me, but rather all of us collectively. Which me has heard God's call and felt God's Spirit? I don't think this is a message for the general public, but the target audience are those who are connected in faith. And I believe all those. If we examine faith history, I think we'll discover that the Spirit of the Lord has anointed many people of faith. But we wonder, do those anointed share the same passion for God's Jubilee that those in Isaiah's time did, that Jesus did, that many others who actually felt that compassion, felt that that initiative to actually do something, to act on the power of that Spirit upon them? Do those anointed share the same passions for God's, I think, Jubilee? The same passage that Jesus and others in Isaiah boldly went among religious leaders and governing authorities, proclaiming freedom for captives, and brought all of that power, all of that anointing to bear on the problems. They brought the weight of faith and the power of God. What trouble is God stepping into in this passage? In Minnesota, political oppression of marginalized communities, Black and brown folk abused, Indigenous stolen from, government housing policies marginalizing BIPOC communities, redlining, didn't authorize government-backed loans in certain neighborhoods, poor and Black and brown, and neighborhood covenants didn't allow marginalized folk to move in. Land stolen. What problems? The House Select Committee did a report. Some of you are aware of it. And in that report, Here's some of what that report notes. That Black and Indigenous babies are twice as likely to die before their first birthday. But when Black newborns are cared for by Black physicians, they're less likely to experience death in the hospital settings. When cared for by white physicians, they were 3 times more likely to die in a hospital setting than white newborns. That's document disparate care. But it doesn't stop at babies. US born Black women in Minnesota are 3 times more likely to die during pregnancy or if within 1 year postpartum than white women. Indigenous mothers are 8 times more likely than white women. 60% of all of those deaths are preventable. Document disparate care. There's a misguided belief still that Black people don't experience pain like white people. And Black patients receive less pain medication for broken bones and cancer because of that belief. There are higher concentrations of environmental pollutions in Black and Indigenous communities. Northern Metals in North Minnesota violated pollution standards for years. Family separation in Minnesota, Dakota, and Ojibwe children have been forcibly separated from their families for centuries. Some children were leased out to white families as indentured servants. Black families, undocumented, the lynchings that we know about, racial discrimination in housing, forced removal of Dakota people, destruction of Rondo neighborhood, redlining, deeming some neighborhoods unworthy for housing loans and preventing Black and brown people from moving into areas that could get those loans, keeping Black people out of unions, keeping any folks of color out of unions and locked in the underpaying jobs, cutting Black and brown communities out of public investment. This nation declared a full stop to normality for this pandemic that we call COVID-19. Has produced 3 viable vaccines in record time, but has left intact a medical system that delivers inequitable and unequal medical care to Black and brown people. And I'm asked, why don't Black people trust the vaccine? The medical community has used Black and brown bodies for research and innovation, but consistently fails to provide adequate medical care for those same Black bodies. Our broken medical delivery system is killing more people of color than white people and providing fewer vaccinations, even though we said publicly we'd be equitable in delivering the vaccine. Though we said that we'd be equitable, we put no investment in repairing a broken, inequitable system, and still, we're asked, what's wrong with the BIPOC community? Then we hear, fresh the Spirit of the Lord is on me, is on us. Black and brown people haven't had some century-long moral failing, some character flaw. Laws and lawmakers have cut Black and brown people out of most opportunities and even disrupted families and businesses that were thriving, and yes, used the law to steal property. But those circumstances, those moral failings on the behalf of the powerful has a precedence. Powerful people, government has been greedy for a long time. Isaiah 61, the Spirit of the Lord steps into the midst of a people being marginalized and cut out of opportunity by political bullies, and God shows up to say it is time to right the wrongs and begin afresh. The Spirit of the Lord is here to proclaim good news to the poor. Good news to the poor, you will no longer be forgotten about or spoken for. Your agency and dignity will be restored. I heard a novel thought in December when I was attending a conference. We should pay people with lived experience for their stories. Researchers make a living off harvesting the stories of those with lived experience. Their stories, the people's stories, should provide a living to the person who lived the story. To bind up the brokenhearted, people's pain should not be criminalized no matter what its source, it should be treated. Good news. freedom for captives, and release from darkness for prisoners, to proclaim the year of the Lord's favor and a day of vengeance for our God. God sees the condition of people. Actually, this passage is not about God seeing the condition of people who have been cut out of opportunities for decades. People who are made the perpetual scapegoats for the sins of the powerful. People who have been underpaid so the wealthy can reap the benefits of their hard work. It's not about God seeing. This passage, it is about us seeing, finally. An event happened that caused people to see. In Isaiah's time, in countless other leaders' time. For us now in Minnesota, I think that event was the murder of George Floyd. I want to know from us here, sharing this time, if the Spirit of the Lord is on you. Are your eyes open to justice? We frequently want God to show up in our world and right everything that is wrong, that is broken, that is sick, that is evil, that is racist, that is sexist, that is oppressive, that reflects the status quo. But listen to the first words here again. The Spirit of the Sovereign Lord is on me, because the Lord has anointed me to proclaim good news. For the past few months, when I've listened to stories about racism and housing, white families who receive loans to buy houses in new communities and build wealth for their families have stated they were unaware that Black and brown people were barred from those same opportunities. Well, if the Spirit of the Sovereign Lord is on us, let's tell the truth. White housing communities actively work to keep Black and brown families out of their neighborhoods and in their assigned places beneath them. Don't tell the truth to feel guilty, but to recognize similar practices in our current laws, and sometimes by the positions of lawmakers. The Spirit of the Sovereign Lord is on us to proclaim good news to the poor who have been sentenced by this nation to perpetual poverty. The good news: sentence revoked, status modified. But justice and good news is not just about a proclamation. Justice is rendering the right verdict for those whom the law previously refused to help, refused to recognize, refused to call human, whose rights were and are disrespected as a matter of course. CC 1:3 said to provide for those who grieve in Zion, to bestow on them a crown of beauty for ashes, a change of the position of those who have been oppressed and marginalized, a change of position and a change of possessions. Black and brown bodies have been commodified for the purposes of enriching white power structures by extracting resources and ingenuity without any obligation to pay a living wage. The Spirit from God is not just empty words, but Isaiah says they will rebuild the ancient ruins, restore places long devastated. Foreigners will work your fields and vineyards, and yes, get paid a living wage. Be provided adequate housing and health care. You will be named, we will be named ministers of our God. Instead of their shame, my people will receive a double portion, and instead of disgrace, they will rejoice in their inheritance. Both of those are overt principles for investing more in communities and people who have been marginalized by historical disinvestment. Reparation is a word you may be familiar with. Repair, pay back what you took and are taking. For I, the Lord, love justice. I hate robbery and iniquity. Those words are on the lips of God, but they should also be on the lips and heart of everyone who's here, of everyone who has breath. Love justice, hate robbery. Justice actually is not a concept. It is, however, very difficult to practice. Difficult because you must have the will to do what is right and righteous. Several years ago, I was in a conversation with a lawmaker, and we were talking, I believe the issue was education. We was talking the right thing to do. And the lawmaker told me that he knew what to do. It wasn't a matter of figuring out the right course of action. What the issue was is having the will to do what is right. We make choices about the degree of discomfort we will endure in the pursuit of justice. Most people decide they will only endure discomfort in the pursuit of what's right for them and those connected to their closed community. But justice is beyond your group, my group, and its ideas. Justice is beyond that. Justice is for right. It is for doing what is right and good for all. It's beyond our ideas for what votes we can get, what we can win, and what policies we can pass. Justice recognizes injustices, all injustices. Racism that marginalizes on the basis of color, sexism that marginalizes on the basis of gender, ableism on the basis of ability, nationalism on the basis of immigration status, and yes, other things too, classism on the basis of income. We rob those marginalized, and yes, the entire state and nation by denying the full imagination, the genius and ingenuity and humanity, every person of every community. Truth, we'd be richer if we'd make justice our aim. Yes, richer in who we raise, who we work with, who we neighbor with, but yes, also richer in terms of our possessions. We'd be richer. There's no question about it. The Spirit of the Sovereign Lord is on us. Will we allow the Spirit move us to address what we need for justice? What do we need for everyone to be housed, for everyone to have good health, for everyone to have an income providing for a good life, for everyone to have the education that they desire, for meaningful work, safety, a means to thrive, representation in public decisions, agency, land? Will we pursue what's needed for justice, or keep following the status quo of pursuing what we think we can get because of likely votes, what's comfortable? A year ago, the world encountered a crippling pandemic. We had a choice to pool resources and collectively take on this destructive monster. The US decided to go it alone. Amazingly, 3 viable vaccines have been discovered to date. While working on those vaccines, we discovered the US delivers medical care inequitably. It still does. More Black and brown people get sick and die from this virus because our system is biased against Black and brown communities. The vaccine is being delivered over the same broken system, and people want to know why Black people, BIPOC people don't trust the vaccine. Because the system has denied us justice, has denied us humane treatment, has denied us dignity. And we've done nothing to correct the injustices in this unjust system. The Spirit wants to know, will we make justice the work we pursue? Will justice be our aim? That concludes my comments.
Oh my, that is a lot to think about. I said at the beginning that you would be giving us all much to ponder and think back on and unpack, and I'm really glad we recorded your comments because it gives me a great deal to think about. We asked people to submit questions, and I'm still just reacting to a number of the phrases you said, some of the things you said, and especially a change of position and a change of possession. Maybe you said those in the opposite order, but how um, challenging that feels, and yet how totally fair and just it feels at the same time, and those realities. So um, thank you. Thank you for those comments. Thank you for challenging us and really pushing us. We have a number of questions, and I'm going to start with one that is maybe the difficult one to answer, but one that really goes to the heart of what we're doing here today. And as the advocate at Lutheran Social Service, it's certainly one that you've thought about. And the question comes about, there are people who are racially biased and act unjustly. There are people who create systems that have unjust impact, maybe intentionally or often unintentionally. How do we address those? How can those be undone? Recognizing prayer isn't enough, and specifically asking, how do we influence policy decision makers and authorities who can make the changes to do it?
So that's a big question. And we could be here all evening if I'm answering that question. I do have some specifics in my head. I won't give you all of them. I promise I won't. So how I think about, so the basis of that question, people who do wrong things. I actually think our systems create people and create the pathways for them to not only do wrong, but to continue to make bad decisions. It was a government decision that said Black and brown folks could not take advantage of housing loans. It made that, and then people actually lived that out. So one, recognizing that our systems sometimes force us to do things that otherwise we would not do. One argument for that, and then I'll get off of this subject. One argument for that is we see, particularly today, how parties are aligned in lockstep to vote a particular way on some key value issues. And when someone in that party decides not to go along, then they punish them and sometimes actually get them out of office. That's not unusual. It's certainly where it is more apparent in some ways, but that same kind of system is at work in other systems, not just in government and in the legislature, but in other places as well. So that's one. Two, hire people like me if you want to change a system that delivers inequitable outcomes. So not just me, but people like me, and not just one of me, but a lot of people, and not just in my position, in every position. Someone who's actually willing to open their eyes and look at what is our system delivering, and the obvious answer is going to be it's not equitable. But then, what are real ways that we can change that? To have some patience about it, because if you get in a hurry, you're going to mess yourself up, and you're going to mess a whole bunch of other people up as well. So I hate patience, but I know patience is necessary. So have some patience about it. And then, so in organizations, and probably what would serve us better is that we have some collaborative efforts across organizations so that we can see beyond what's happening in one organization and see how those organizations are working in partnership to disenfranchise whole communities at times. How do we make the legislator act right and people that we get elected? I think the only way that we do that is one, so the passage talks about the Spirit of the Lord being on us, and it also talks about enacting some real change. The only way that we can react to real change is to recognize, I don't want to be uncomfortable, but we have to experience discomfort if we want to see the legislator, our lawmakers, do what's right and what's just for everyone. That is a very, very hard challenge. I don't say that lightly. No, I'm not nearly the person that a whole bunch of people are, but I've gotten death threats because I chose to call some things out, work with some people, work with either to get some people who are going to do the right thing and be accountable to good people, good policies. And nobody knows who I am, but still. So doing the right thing costs, but it also pays, which we don't talk about frequently. So working together, as this coalition does, working together to hold lawmakers accountable when they get in office, while they're getting in office, when they're talking about running for office or trying to influence somebody else. So that's not really quick, but those are some initial thoughts.
I will say, from my personal discussions with Paul around Reverend Slack, maybe I should say, around issues of race, one thing that I've really been struck that he always says is just start. Just start. Instead of figuring out what you should do or where you should start, just start. And I think that's such a powerful piece of advice. Instead of figuring out the time or figuring out, you could always just start. We got a very another challenging question. Do you have any recommendations for strategy of reparations for Black, Indigenous, and other persons of color?
Yeah, I've actually written something about that. But so these tough questions, I can't answer them on the call, not completely. So if we really think about reparations, here's my simple, equation to reparations, and I recognize it's not simple. If you've, disenfranchised something, an investment that was supposed to go to a particular community that did not go, then you owe that community what you actually stole from that community. Are there real life examples of that? Yes, there are. So I'll talk about our policy during an era of a time with a president that I actually like. So I won't go any further with that, but I'll just say that. So the policy was that certain infrastructure investment would go to poor communities first. I mean, that was actually the policy. It was actually written in law. The problem with it is that there were no shovel-ready projects in those poor communities. And on top of that, the adequate training wasn't given to people in those communities so that they could get those high-paying jobs. So what happened? Even though we had a great policy, right? Those jobs, those infrastructure jobs, those good-paying jobs did not go to the people that it was intended for. So swing and a miss, right? So what do you do about that? A part of reparation, this is, again, surface, a beginning, not the beginning, is correct that. So how do you correct that? Go in that community, make sure that those folks get the training to get really good high-paying jobs, not just for now, but for generation upon generation, right? Make sure that there are projects there that are really building up the infrastructure so that there are not only good jobs, but there's fresh fruit, there's, et cetera. So that's an idea of reparation. There are many, many others that I could go way back in history and talk about, what have been stolen from folks. We know the stories. I referenced some of them. Land that has been stolen from indigenous community. And okay, I won't say what I was getting ready to say because I was getting ready to get in trouble. but land that was stolen, and not just land that was stolen, but children that were stolen. And not just children that were stolen then, but right now, if we look at our in our family services as well, the welfare system is out of whack because the children that are in out-of-home placement, the statistics for Black and Indigenous children is off the charts. And there's a bill right now that's going around right now that we don't want to do the right thing with. Okay, I'll stop.
I'm going to make a comment about just one bill. The JRLC on our agenda is supporting the maternal mortality and morbidity bill. If I'm a Native or Indigenous woman, I'm at least 4 times more likely to die during or as a result of childbirth. And if I'm Black, I'm at least 3 times more likely to die during or as a result of childbirth. And that's taking into account, it doesn't matter if I'm married, if I'm making $200,000, if I graduated from an Ivy League school, if I work in the hospital where this is happening, accounting for all of those pieces. And so there clearly are biases, and we need to look and address these. So that there are a lot of these. I'm going to just make one comment and then ask a question.
Real quick, though, and a lot of people are talking about Serena Williams, who we know is not poor, but the maternal health issue and almost died. So if it can happen to her, imagine.
So I just want to share with our members and all the attendees that we've been talking with Reverend Slack at Lutheran Social Service about having a series of webinars around race with the JRLC. And so I know I just said a moment again, he says just start, but we're not going to do that until after the session's done. So that doesn't mean that we're putting it off. It's just not the best time, but you'll be hearing more about that. But we got a question from Bob Holtine with ELCA. What good trouble can we get into during this legislative session with the Spirit of the Lord upon us? So I'm going to close with you answering that, and then we're going to move into our panel.
While the list is long, I'll mention one thing. So right now, GOP does not want to support eviction reforms, and there's several things that fit in that category. So what statistics show is that evictions affect Black mothers at a very, very high rate. Evictions stay on people's records forever. You don't have to go to court and be convicted, at fault for the eviction. None of that. It's on your record once it gets filed. So there are many things. I mean, if you really want to go all the way out there, support John Thompson's bill. But let's talk about evictions right now. So if we can get support for evictions, if we can get Republicans to actually support that, that would be fantastic, phenomenal. A game changer because of the eviction reforms, yes, but also because we can get Republicans to look realistically at something that's not, quote unquote, supportive of just landlords, but something that's good for landlords and tenants as well. Having that conversation, pushing people to really talk about the meaning of eviction reforms and how to have laws that are good for everybody. That's one. There are many. That's one.
Thank you. We're going to continue to hear from Reverend Slack because he'll be joining our panel. I talked earlier about our remarkable board, the JRLC board, and I'm going to turn it over to our board chair, Rachel Babbitt, who's the Missioner of Engagement with the Episcopal Church of Minnesota, and she will introduce our panelists. I would ask you, again, if you have questions, we have some time at the end of their panel for questions and answers. Please submit them in the chat, or excuse me, not in the chat. Don't submit them in the chat. Submit them in the Q&A, and I'll be monitoring them, and toward the end of their time, we'll be asking some of those questions. So I'll let you meet Rachel. Thanks.
Thanks so much, Anne. And I just want to take a point of personal privilege and say thank you, Anne, for coordinating so much and doing so much for this day. And thank you all for taking the time out of your schedule to join us in this weird time. This is our second day on the screen opposed to Day on the Hill. And we are just so glad to have over 275 people with us today. It is really important that we work on justice. So with that, I am going to happily introduce our very amazing panel. First up, we have Dr. Anthony Stately. Anthony Stately is a member of the Ojibwe and Oneida tribes. He is the Chief Executive Officer for the Native American Community Clinic here in South Minneapolis, which provides primary and dental care and behavioral health services to Native American communities in the Twin Cities. He holds a PhD in clinical psychology. Previously, he worked at the Indigenous Wellness Research Institute, the University of Washington, Seattle, as Director for Honor Project and co-investigator for a grant addressing obesity and cardiovascular disease with the Northwest Tribe. He was inaugural program director of 7 Generations Child and Family Counseling Services, a clinic serving American Indian children and families, which he helped establish in Los Angeles. Dr. Stately has been a consultant to numerous international, national, and local agencies and has taught in several graduate programs in clinical psychology. Thank you for being with us tonight. Ms. Blair Harrison, Senior Advisor on Health and Homelessness and Housing in the Minnesota Department of Health, is a trained infectious disease epidemiologist. Her current work focuses on systems transformation, specifically the political determinants of health, structural barriers, and policies that limit the advancement of health and racial equity. Blair has a certificate in trauma effective leadership from the University of Minnesota and works at the intersectionality of social justice and public health, something we need so much of. Thank you for being with us tonight. Ms. Deb Holman is the Homeless Outreach Coordinator for CHUM in Duluth. Deb has been a tireless advocate for persons experiencing homelessness in the Duluth area for over 15 years. Currently, Deb has partnered with the local public health department to ensure healthcare access and vaccines to persons who are unsheltered. She has worked collaboratively with legal professionals and community support services in helping to break the cycle of homelessness, chemical dependency, mental illness, and crime. She has been the recipient of the Minnesota Coalition for the Homeless Bruce Vento Distinguished Service Award. I was at that convention when you were, and the KUMD Radio Women's History Month honoree. We are unbelievably grateful for our panelists to joining us this evening and that they have taken this time out to share their thoughts on such an important topic. So with all of that, let's get started. So
I'm just going to interrupt for a moment. It looks like, Deb, can you unmute yourself and make sure that we can see? So with that, I'm going to
great.
let.
Looks like we're set.
Go ahead. Thank you.
Gotta love technology. Normally we would be on a stage with chairs and all kinds of things, but a year into this, we've somewhat figured this out. So my first question to our panelists, and feel free to whoever to jump in, what efforts have you and your organizations made to assure that vaccines are available to these at-risk populations?
Well, so in my role at the Native American Community Clinic, well, first of all, before I make any remarks, I wanted to start first by thanking Anne and Rachel and everyone else that's part of the JRLC for the invitation to talk with you tonight. It's an honor and a privilege to be asked to be part of this panel, and I want to thank Reverend Slack for doing such an amazing job with this introductory remarks. It's it's an interesting time for sure to be alive. I've been alive a long time. I'm 58 years old. I lived through the 60s and the 70s. I lived through the civil rights movement and the AIM movement. And, you know, I watched a lot of my brethren die from the AIDS epidemic and pandemic. And I've seen a couple of other things. But this last year of my life has uniquely been one of the most deeply and challenging, spiritually, emotionally, and at times physically. I actually got COVID in November, and I was sick in the hospital for a week. I'm pretty happy to have survived that. I had a moment there where I didn't know if I was going to come home to my children. So I want to start by saying that the thing that was uniquely sort of like, I think the turning point for me when I was in the hospital was, you know, so I laid in that bed and I listened to other people in the hospital crying out for their family members, crying to go home and desperate. I had asked my sister after my first night there to bring me medicine, tobacco, cedar, sage, some sweetgrass, things I could hold in my lap and pray while I was in the hospital. And I prayed, I asked for that medicine because I was afraid. I wasn't going to come home to see my family. And I started my prayer by saying, you know, asking Creator if I could just stay for a little bit longer, because I had a lot of work I still needed to do in my community. But I also had a lot of people I loved that I needed to be with. And I had 2 children that needed me to continue to raise them into strong Dakota men. And so so somebody asked earlier, like, where do we start? And I think prayer is a perfect place to start. Whenever we're doing hard work, whenever we're doing the Lord's or the Creators or Allah's work, like prayer is the perfect place to start, especially when we're lost, right? And we don't know where to start. So that's the perfect place to start. And I believe tremendously in the power of prayer. I know that, when we pray, the Spirit of Creator moves through us and amazing things can happen at that moment in time. So I want to encourage everybody to pray every day and be grateful for the life you have today, and pray for the strength and the courage to be useful, right? And to be fair and to be just and to be a good relative as you walk the planet. Because none of us are guaranteed tomorrow. None of us, right? And I want to also take this moment to acknowledge that we are standing on Dakota land. If you're in the state of Minnesota, you might be teleporting in from somewhere else, but if you're in the state of Minnesota, you are standing on Dakota land, the land that belongs to my children and their ancestors. And so I wanted to start my remarks by saying that. I think, when COVID-19 hit the community, NAC was thankfully, we were well prepared to sort of pivot and change fairly quickly, and from sort of seeing patients in person to virtual, which was a godsend for us. We had done some things upstream the year before to prepare, not knowing necessarily that we were laying the foundation for like having to pivot and change, but we were able to do that, and we were able to do that well. We also had spent a lot of time the year or two prior to sort of like where we're at, doing some internal work within the organization about talking about equity and fairness and racial injustice, and challenging the organization and the people within the organization to sort of really look internally and around us, like what did we want the organization to look like? How did we imagine fairness and equity looking like in the actual, not just in the words or the things that we say, the taglines on the bottoms of our emails or the words on the wall and those kinds of things, but actually in our actions with each other and our actions with our patients. I asked my staff at one point in time, what do you imagine would change in our relationship with the community and the people we serve if we stopped calling them patients and we started calling them relatives? Like, how would your work and the way in which you approach your work and the way in which you interact and join with the people we serve change if we thought of them as our aunties and our uncles and our grandmas and our grandpas and our nieces and our nephews, people who we are relatives to? And I think there's a ceremony in Dakota culture called the Hunka ceremony, and it was and it is first described in this legend of how the Ri, which is the original people of the Arikara, are the Hidatsa people, and the Lakota, and how they used to have these bloody wars over the corn. They used to think like, each of them thought that the corn was the God-given right for them to have and to hold and for their possession only. And then a prophet had a dream, and in that dream, a vision was given to him, and a ceremony was given to him, the Hunka ceremony, the making of relative ceremony. And what we learn from that dream and that ceremony is that when we make someone else our relative, when we make the other our relative, our brother, our sister, our mother, our grandfather, we make them important to us, related to us, it is impossible to kill them and to harm them and to do them injustice. So the very nature of like reparation and the very nature of some of this is that notion, that idea of relatedness, right? And so we had gone through that process of laying that foundation. And so, over this last year, my staff have had to work 50, 60 hours, and only get paid for 40, and, work on the weekends to serve the homeless people, and the unsheltered homeless folks. I have asked my staff, and they have stepped up and willingly done it without me even having to actually voice the request, right? And I think the reason that we've been able to do that is because we laid that foundation over the last 2 or 3 years. And that foundation was slow, and it was a long process, and it wasn't easy. It was hard at times, but it was worth the investment because it's paid back in spades. And so we've had, I've had staff out, walking the streets and talking with homeless people, identifying people. Blair knows this. We do work with her department really closely. Oh, hi, Kitty. She's beautiful, or he's beautiful. And so, like, I think that's also been. But I also, in my position as CEO of NAC, I've advocated with the governor's office and the commissioners of DHS and MDH and practically every other agency that will listen to me about the importance of getting this vaccine out to Black and Brown and Indigenous communities rapidly, because the data shows that we're disparately impacted, right? So that's the one thing that I think is important, is that like we also use our voice to draw attention to the inequities. We use our voices to call upon our leadership to do the right thing and put pressure on them to do the right thing. So those are kinds of the ways that I think NAC has been able to do that.
Great.
at work.
Yeah, thank you. That's so wonderful. Blair, Deb, do you want to talk a little bit about your organizations? And Deb's in northern Minnesota, Blair's, I believe, in the metro area, correct? And so why don't you share a little bit about that, building on what Anthony said.
Could you repeat the question?
Yeah, it's really about, how are you able within your organizations to address the disparities of vaccine access and really helping folks that we know are already marginalized and likely to be pushed aside, but yet still helping them get their access.
Great. Okay, thanks. So yeah, I'm Deb Holman. Forgive me, I'm losing my voice a little bit. So I hope that I took the day off so I wouldn't use my voice today, so it would be rested. And I also have a house full of dogs, so I hope they don't start barking. It, like Dr. Stately said, it's been a very challenging year. Not only, I guess, fear within ourselves about what's ahead, but also continuing to work in the field when many of us were at home, quarantining. There was a lot of us out there still, meeting with folks that were homeless because they needed us to be there and we didn't have a choice to stay home. So I think we have a very strong community in Duluth where we partner with a lot of agencies that, help to bring these disparities, help to, disperse some of the disparities that we face. And I think, CHUM has been arranging services for the vaccine in places where people feel comfortable and where people are, where they're at, not expecting them to come into a clinic or, go to a doctor's office or to a hospital. We are bringing the vaccine to them. So with no expectation of them getting them, although I've had many folks that I work with asking, hey, Deb, did you get the vaccine? And just sitting down and having a conversation with them about getting the vaccine and why I got the vaccine. Sometimes that changes a person's perception. I think we're at about 50% capacity so far of folks that have got the vaccine. I did write down a few notes, but so, we're doing pretty good. We haven't really had any issues with that in the homeless community at CHUM. From the earliest days of the pandemic, this community's pulled together and prioritize people that are experiencing homelessness in our COVID response. We've had 3 vaccine clinics at the shelter. We've had 3 vaccine clinics at the warming shelter. And I think, we could be mobile to people, in camps going forward as well. So I think we're making a remarkable progress. We have great partnerships with the hospitals. There's a homelessness and healthcare, team that meets, and we work real close with the UMD Medical School. We bring all those services into the shelter. We're not quite bringing them to the street yet, but there are many conduits of groups working together that can help get people into the shelter, and it's all about building trust. And so that's what I have to say on that.
Great. Thank you, Deb. Blair, thoughts, other pieces?
So many.
I know, I saw your head shaking so many times. It's great.
Yeah, I am so moved by everything that has been shared, and also just really appreciative to be here with you all tonight. So my name is Blair. For the last year, I've had the incredible honor of working on our homeless and sheltered COVID-19 response as part of our state response team. I think even taking a step back from vaccines, one of the things that I've learned in this response is that the settings and the population that we're serving are unique, and it's different than the rest of the work. There's a need to be trauma effective in everything we do, to be anti-racist in everything we do, to really honor the intersectionality of this work. I think we've Reverend Slack, Dr. Stately spoke to this, but COVID devours intersections and ways in which communities have been made to be vulnerable by histories of generational structural violence, by current racist policies. And when we look at a population of people experiencing homelessness, we can't take a traditional standard approach to how we effectively mitigate a pandemic. It needs to be done in a way that is driven by really specific needs of individuals, and really also directed by community. And I think that's one of the biggest things I've learned as an employee with the state and somebody who works at the state health department, is that my job is to get resources out the door to community-based organizations and to community leaders who have been impacted by homelessness, because that is where those solutions come from. And that's why we've been so successful in this response, is because of the work that's done in community. If we look just at the need for vaccination, people experiencing homelessness have been impacted really significantly by COVID in Minnesota. If we look at those who sleep outside and who are unsheltered, 47% are hospitalized for COVID compared to 5% of Minnesota on average. They're 8 times more likely to end up in the ICU. And that alone, to me, speaks to the need to vaccinate early, to vaccinate in a way that's culturally responsive and effective. And so from the perspective of the state health department, we did in November started conversations with the CDC about how Minnesota, who's been a model for our homeless response across the country for the last year, really saying, how are we going to do vaccination? And knowing that it would take all of these pieces, as Dr. Stately said, working with NAC, who we worked with on testing to also do vaccination, working with those same community-based partners, and really developing a plan that would reach every corner of the state for people who are experiencing homelessness and wanting to be vaccinated, and the service providers that are working with them. Minnesota is one of the only states in the country that prioritize people experiencing homelessness and providers in 1A of the vaccine rollout. And I think just another thought about that, and thinking, Reverend Slack, the comments you had about just an inequitable initial rollout of vaccine. And when we look at something like we're going to do 65 plus, that is not equitable vaccine distribution. That does not account for lower life expectancy in communities of color and Indigenous communities and people experiencing homelessness. And the reason for that difference in mortality is not individual choices or behaviors or bad decisions. It is all of those systemic racist drivers that have gotten us to that point. And I'm personally always really careful to not say a vulnerable population. It's a population who's been made to be vulnerable intentionally, systematically. And that impacts how we think about then the need to do these different things, like intervening with early vaccination and getting people at the front of the line, because that's where they deserve to be. And that's where they need to be to reduce risk as much as possible.
And so much of what you're talking about is science-based. It's real data that is proving how much more vulnerable these populations are. And so all the more reason we should be creating systems that aren't in place, because our systems do not already support these folks. As a former, I used to work in homelessness and family homelessness for a decade here in Minneapolis. That makes so much sense to me. And I can't imagine not being at the front of the line. I also love these points of, really showing up where people are at, that these community organizations are the key to helping get these folks to trust the vaccine, to have access, because goodness knows there's so many other access points that are challenging. And I just want to double tap that, as we always say at work, of like, it's these community organizations that already know these folks, that have relationship with these folks, that are far more likely to show up at a vaccine clinic that Dr. Anthony's program is going to offer than, the one that's happening at Canterbury Park for, all these other folks. I'm interested, a little bit more about where do you guys see the system? That's a big word. This is a big question. Where's the system broken? Where are the pieces that you guys are, Dr. Anthony's already laughing. Where are the challenges you're already finding? Because we as these 275 people of faith care about justice and care about showing up for these folks. And these are the pieces that we want to change. So where do you see this brokenness and these roadblocks?
Well, first of all, I want to say, like, thanks, Blair, you did an amazing job, first of all, in laying the foundation for some of these discussions. But I think one of the things that is broken for sure is, well, broken, I guess. I chuckled. The reason I chuckled was because you were like, oh, can you just talk about this? And I was like, well, this is kind of like 4 years of college.
Right. This is an hour, 2-hour conversation. Come on, what are you talking about?
Right. I was like, this kind of like about 20 dissertations. But I think, yeah,
Done with it.
because I think one of the things that, so when we're talking specifically about some of the most vulnerable populations, and in this case, we're talking about Black and Brown and Indigenous communities, these are communities that have, and by the way, in the state of Minnesota, those communities have the lion's share of the people who are homeless, right? It is a travesty that the Indigenous people of Minnesota represent the highest rate of people who are homeless in this state. We are the original landowners of this state, right? And I think part of that also is like, one of the things I want to encourage us to think about is like, when we think systemically, it's like, how did we get here? It didn't happen in a year, it didn't happen in 5 years, it didn't happen in 50 years. It happened over many decades, if not centuries, of like failed policies and a few things. So I think it's important to understand that 40, 50 years ago, the United States declared war, right, on drugs, but what it really declared war on was Black and Brown people, right? If it was interested in declaring war on drugs, it would have done something about, racist policy. It would have done something more pervasive and expansive and transformative about poverty, about education and all these other things, instead of sort of kind of just dipping their toe in the water, so to speak. And so we're at the place where we're at because of years and years and decades of failed paternalistic policies that people wrote because they thought they were doing the good thing, doing the right thing. But racism by its very nature is white folk making decisions about Black and Brown people without including Black and Brown people in the design of the things that would help them, right? And so that's why many of these policies failed. Nobody really thought to ask the people themselves, like, how could we do this and do this well, right? Or value their voice. I want to just give really quick props to Blair. Blair is like one of the first people in the state of Minnesota that I worked with in some of the work that I've been doing, that has said to me, like, actual phone calls we're having when we're talking about our contracts and the kinds of things that we're going to do. She's like, you guys know this community, you tell me what you need and it's my job to get it for you. I was like, can we get like 100 more of these people in this state agency? Right? Because that's the kind of attitude that we need, and the sort of like a recognition of like, there are people in the community that have been doing this work for decades and years, and they know this community really well, right? We are of that community. The work I do in NAC and South Minneapolis, I was born and raised. Franklin Avenue raised me, right? And when I say those people are my relatives, I'm not just saying like an Indigenous person, like, hey, we're all related. They're actually my aunties and my uncles and my cousins walking in the clinic. And so part of it is like, and so when I go and do things like I talk to legislators and stuff, I like, you must listen to me. Like, this part of your bill isn't going to work. And here's the reasons why it's not going to work. So encouraging your legislators to stop and take the time to listen to the voices of the people that they're writing laws about. Asking them, did you go and talk to those people? Did you go and visit them? Did you drive down to the area and see how that's gonna impact them? Encourage them to be a participatory sort of relational model here of policy making and governance. And that is one way that we can start to change some of this.
That's great. Yeah, this constant perpetual, I'm going to project my, thought or opinion or what is best onto you is way we've done it for centuries. And what we know is that doesn't work. We need to include people that are experiencing whatever issue we're organizing around or making policy for, and having them have a voice in the system.
And we need to listen. We need to open our ears and listen.
Truly listen.
Yeah.
Reverend Paul Slack, jump in. Oh no, you need to unmute yourself. Darn it, we can't hear you.
I'm sure it was amazing, though. I'm sure it was.
That was a process. I had to hit 3 buttons to unmute.
Goodness.
So-
Technology. It'd be so much
so-
easier if we were on a stage.
right. I'll make it quick because I've talked a lot, but I'll make it quick. So why is it broken? So Rachel, I'm gonna push back a little bit.
Okay,
Uh,
go for it.
The system actually does work, but who does it work for?
Absolutely.
Right. And that's the question. And sometimes I don't think we emphasize that enough, because it is intentional in producing the results that we're getting. And so from my really quick perspective, what's wrong with it is our systems are being controlled by people with all of the power and people with all of the money. If we look at, if you have enough money, you can get out of about anything. So we have a great example, right, of late. And I won't mention the particular of that, but we have a really example. If you have enough money and enough power to go along with it, it does not matter what you do. That becomes right. If you have enough money and enough power, you can get, a vaccine right now without signing up for an appointment. So we look at that in the macro, but we also look at that in every other space where systems are at work to disenfranchise people who don't have money, who don't have agency, who don't have power, or who don't have enough of it. And we need to flip that. Caring for people can't be about how much money you have or don't have, right? Having the things that we need to thrive can't be about whether you're housed or unhoused. It can't be about those things. It has to be more about humanity and truly providing the care that we all need to live a life that we can be proud of. I'll stop.
Well, and I love that, Reverend Slack, and I'm gonna use that phrase again, that the system is working for the people that it's designed to work for, which is a great reminder all the time. But the other piece is that our faith, we're the JRLC, we are the Joint Religious Legislative Coalition, and so our faith calls us to service to the other, to reach out to those that the society has pushed off to the side. It doesn't matter what faith tradition you're a part of, they all talk about that. That is the core unity of who we are. I am sorry to say we only have a few more minutes of our panel time. And so I'm gonna ask a question for each of our panel members, if you will jump in. What is giving you hope in this moment?
I can jump. Dr. Stately, I saw you unmute at the same time.
There's all these cues of how you're going to start next.
We've learned.
You can go first.
Okay. So I think for me, one of the things that gives me a lot of hope is I've seen through our really great community partnerships and engaging with people impacted by homelessness, I think for the first time in my work in state government, some shifting of what equity and advancing health and racial equity actually means. And I go back to thinking about a meeting I was in several years back with Jackie Dion, who's the Department of Health's tribal liaison, where somebody had said to her they were working actually on an infant and maternal mortality reduction project. And what they said was, what if the goal is that we reduce infant mortality by half? And most of the people in the room were like, that's amazing. That's a huge reduction. That's great. And Jackie said, no, I want American Indian babies to live as often as white babies. That's what equity looks like. And I think in this work around homelessness and housing in the pandemic, that's the thinking, like really challenging ourselves to think about what equity actually looks like and how the legislature helps us achieve that, how our partnerships help us achieve that. The accountability just feels so strong. And so really thankful that all of you will have that opportunity next week to talk with people and really raise up these really important issues and just challenge you in those conversations again, to just think about what does real equity look like and how do we do that in this work.
Oh, great point. Thank you.
I think one thing that gives me hope in all of this is something Blair said earlier, and I didn't realize that, Minnesota has such an investment in homeless, Indigenous people of color, getting people vaccinated. I didn't realize we were leading that. That's really the first time I've heard that tonight. And just for me, there are many days I can feel hopeless in my job when I look at some of the barriers people face as, we see COVID, HIV numbers rising, just a lot of stuff, the drug use. I think just what keeps me going is, I think that just being allowed into people's lives and being a friend. Like Dr. Staley said, he likes to think of the folks as relatives. Well, I personally don't like calling people clients either. I've had my own experience with drug use, and I remember there's a time I fell and I was already doing this work and had to come back to it. And, I was reminded, it's kind of like, it's like doing the work of Jesus. And I say that very humbly, but that's how I look at my work. Jesus, the person, the one that, accepts everybody, treats people with dignity and respect. I feel very fortunate that I'm one of the people in Duluth that I feel like I meet the world's most wonderful people. And I mean that sincerely from my heart. And just living in a community in a state, I worked in Minneapolis before I came to Duluth for a number of years. And just like Duluth, we really come together. Minnesota comes together, but I'm in the moment in Duluth. People, we work out of the box here. We don't work 9 to 5. If somebody needs some assistance on the weekend, or I don't know, I'm getting off track, but I just think it's the kind of teamwork and the support and the resilience of the people that I see every day that keep me going.
Thank you. That's wonderful.
Thank you, Deb. That was beautiful. I think a couple of things that give me hope, or one thing that really gives me hope, is over this last year, I have seen such amazing participation and such amazing movement among our young people. The recognition among our young people. Like, I don't remember being that awoke about these issues when I was in my early 20s. I knew there was things were not right and not fair, but I don't remember being as the space and place where many of our young people are in our community, and so that gives me a lot of hope. Gives me a lot of hope when I see, teenage and young adult Black and brown and Indigenous people of color, kids of color who are out there demanding justice, demanding that the right thing be done, making our issues visible, talking about these things and being out and center about that. It gives me hope when we see those individuals showing up in the polls, swinging states, right, that historically have not been very just to our people. That gives me a lot of hope. I think that while the pandemic and of course the horrible and unjust murder of George Floyd and so many other Black and brown men and women over the last several years has lit a fire under our community, I think that's that gives me hope when I see our community respond in that way. right? In Minnesota, I'm proud to be a Minnesotan. We lead the charge in practically everything that is good in this world. I really believe that. So, I'm honored to have been part of this panel tonight. I'm honored to have sit with such amazing panelists and guests, and very, very grateful and thank you for having me here. And I want to encourage you to continue to pray. It is the one thing that is free to all of us and we can all do that does produce change.
Love that. Thank you.
I'll
Reverend
get,
Slack?
I'll
Yeah.
get,
your
I'll
hope.
get two things real quickly. So one, we're actually talking about racial equity at the legislature. Yeah. For me, that's huge. That gives me hope. Some people don't want to talk about it. We're still talking about it. Gives me great hope. The other thing is that I'm getting to share this time with JRLC. That is hopeful to me to be here, to be in this conversation, to recognize what I think you said, Rachel, is that faith gives us hope. And the other thing that I said that I'm not sure if everybody saw, when faith folks actually come together, it's powerful. When we forget about, our own, little isolated, unique labels and figure out all of us are after, really what faith calls for, and that is justice, that everyone deserves dignity and respect and agency. Everybody deserves that. Everybody deserves to be treated, like the sacred creations that we all are. And we actually do have what it takes to live together in a collective peace and in a collective power. So
Yeah.
being here with you all and sharing that spirit gives me hope.
Thank you. And I'm just so honored to be with you all tonight. So I'm going to pass it to Anne, who's going to do a little of the Q&A.
Well, we actually had such wonderful comments. We don't have a lot of time for Q&A, but I want to share a couple of things. A reminder of the phrase that nothing about us without us is for us. And we really need to listen to people who are impacted, those with lived experience, and make sure that they're part of making decisions. And I think all of you spoke to that beautifully. A number of comments, and a couple of people have my text or email, have been sending things that way as well. But a lot of comments around the broken system, even before that was really called by the panel. But is our system broken, or is the system working the way it was intended to work? And so we have the worst achievement gap between white children and BIPOC children in the nation. We have incredible health inequities, as we've heard about here. We look at housing and the history of redlining and racial covenants, and not just how that impacts housing, but how it impacts the ability of accumulation of wealth and transfer of generational wealth and all the pieces that go with that. And so we'll be continuing to look at those. Those are issues we hear about a lot in our work, but a lot about that. I think that the things that I heard, the one I'm going to ask you is, if each of you were to offer a piece of advice about something concrete that our attendees can do to try to create a better world now, what would that be?
Donate your time and your treasure for the causes that mean the most to you, including this one. So it's easy to speak, but show up, do the work, be an ally, donate your time and your treasure.
I will be more specific and less beautifully spoken than that. But I think just thinking about the advocacy work of this group, the governor's budget includes $10 million of an increase for the emergency service fund in the next biennium. Those are the exact dollars that allowed us to create 2,800 temporary shelter options for people in the last year. Incredibly important funding to sustain this work of ending homelessness in the state. And the budget's not a given. So just for everyone to know, it's not supported across all parts of the legislature, the work you do to support the governor's budget, particularly that piece, supports the work that we do to end homelessness.
And
Can I
I
make
want,
a revision?
I just want to share that they're going to see a slide where one of our two asks, 3 if they have time, is for $15 million this biennium for that program. So I didn't tell Blair to say that. It just shows that it's so key to what these issues are. So go
You
ahead.
should outdo me. Can I make a revision to my thing? Okay. So this involves your time, not your treasure necessarily. Also talk with your legislators about encouraging them to give as much resources to the rebuilding of Lake Street and South Minneapolis as you possibly can. The businesses and the institutions that serve Black and Brown and Indigenous communities in South Minneapolis that were completely gutted and destroyed in the aftermath of the Floyd murder. And the resistance in the Senate, particularly among the Senate, the Republican senators, to give resources to rebuild that that part of our neighborhood that NAC is in the center of, is absolutely critical. It speaks to the heart of equity, which is not just going back to what's normal, but restoring it better than it was before, right? And giving people an opportunity to have safety and shelter and a bunch of other things that are important to them.
I'm going to call on Deb, and I'm going to give Reverend Slack the last word. How's that?
I'll make it quick. So yeah, I will. Every organization should align our resources to ensure every person is in safe, stable housing.
And
That's
Deb,
it.
are you there? If you could give us advice on one specific thing you'd recommend that people could do to help work toward the common good and make a better world, what might that be?
Well, that everybody would have safe and secure housing. Without it, they just can't move forward. And that we would just support that and get there. I've been doing this work for 20 years and I'm just seeing the numbers rise. So I would like to see housing for everyone. Thank you.
I want to say thank you to this panel. This could have been significantly longer, and we may actually invite you back. Your comments have been
Yes, please. I want them all back.
insightful and thought-provoking and heartfelt and very human. I mean, it's clear that you are walking with the people that you're serving, and it's just wonderful to hear the work that you do and inspiring. So thank you for the wonderful good that you do. Thank you for working in partnership with the JRLC and all the other groups that you work with. Thank you for joining us this evening. When we talk about time, talent, treasure, I think we've really seen wonderful willingness to share your time, your talent, and your treasure with us this evening. And I am so grateful, as I know all of our attendees are. So thank you so much to all of you. And we're really proud to be partnering with you in this work. So thank you very much. It's hard for me. We're going to move on to our legislative part of the program, and I feel like it's not going to be quite. It's a whole different approach. So we'll see. We'll have a little bit of heart in there. I feel very passionately about these issues, but it's a little different approach. I know that we've been on screen for a while, so I'm going to start by asking Bob to make me a host, and we're just going to get kind of a feel of who we have here, and I'm going to do a little bit of polling if I can get that to work. While he does that, I want to do two things. I want to make sure and say we've talked about our board. I want to make sure and thank our staff. So our advocacy associate, Angela Huntington, has been remarkable in putting things together. So hooray, and very appreciative. This could not happen. And she's just been remarkable. So thank you to Angela. And also you'll hear from Joan Miltenberger. Some of you haven't had an opportunity to meet Joan yet since she's newer on staff. She's our new statewide organizer. Incredibly gifted in a number of ways, and you'll really see as you work with her how important relationships are to her. And one of our comments was it's all brick by brick, relationship by relationship. That's the work we do at the legislature. That's the work we do with one another. That's the work we do in our community. And so I really want to thank her. Oh my goodness, and there's my phone ringing. Thank her as well. So wonderful for that. So we're just going to do a quick poll. It's usually we do this through a show of hands when we have our day on the hill, but we'll do it here. So just to get a sense, does this show up? Can someone tell me if you can see the poll? Probably not. If I say launch the poll, can you see the poll? Okay, so we usually ask people how many times, how often you've been today on the Hill. And what's really great about it is the people that raise their hands, they have been here for a long time. We say, go talk to them when you have questions, if you want to know what to say to your legislator. But so I would like people just to vote. We'll do a quick view on that. You can kind of see that changing. And I don't know if people can see the entire poll, but so that's our first question. We're getting a lot of number of answers there. I can't see the end of that. Number 2 was I attended a few times and I missed being at the Capitol. So we hopefully, I said to Bob, there's a phrase within the Jewish tradition, next year in Jerusalem, and I say next year in St. Paul. So hope next year in Jerusalem as well. But so you can see we have a number of people here for the first time. It's wonderful to have you here. I hope you're enjoying our presentation and getting a good feel for what the JRLC is about, both in terms of the interfaith work that we do, but also the importance of really recognizing that we want everyone in our state to have opportunity, whether that's economic opportunity or so many other things, that we're all children of God and every human should be able to live in the dignity to which we all believe we're entitled. So much of our work really focuses around those concepts of justice and human dignity. And I think our presenters did a wonderful example of talking about that. So our next question, the second, I don't know, I'm realizing I'm new at this. I'm really stuck here. So we may not be able to see all the questions because
and this is Bob. The participants just scroll down and they answer all questions at once and submit.
Okay, so then I'm going to end the poll since hopefully people have had that. So let's see what we had. So first time, how many people have attended the first time? As I said, pretty tied, a first time or a little bit after that. When we look at have you contacted your legislators, we have most people for call or written. And we're hoping we can move more of those people to visit. You're going to have the opportunity, we'll talk about this in a little bit, to have you talk to your legislators through Zoom. I put that second to the last answer about, yes, I visited them, but they asked really hard questions that I couldn't answer because that's what everybody's afraid of. I don't want to go meet with them. And what if they ask something I can't answer? What if they say, what's the fiscal note on that bill? I need to know the answer to that when I meet with the legislator, but you don't need to know the answer to that. So you can simply say, I don't know the answer, but this is a problem in our community and we need you to address it. How are you going to address that? So you don't need to be intimidated. We're going to help you through that. That's really what Joan's role is. That's what I do. So it's really nice to see that we have a significant number that have called or written and have gone to meetings. And you look at, those are great. We have 46% that had a great meeting and 2% that said they asked a question that they couldn't answer, but they didn't say it was awful because I didn't really give a choice to say that. And then the last, working on building relationships. That's what the JRLC is all about. So you may have a legislator that doesn't agree with you this year, but we really want you to work on building a relationship with them so they can begin to understand the issues that you care about and you can really be a resource to them. And then Bob, can you make the third question show up? I don't know quite how you did that, but our third question was just to lighten the evening a little bit. What's your favorite season? And so I can't see those results. So if someone could tell me what they are, that would be great. I can't scroll. Oh, there they are. Oh, whoa. Oh my goodness. This is our first webinar. Can you tell that? So by far, fall is the favorite. Well, not by far, but pretty significantly. Fall, summer, spring, and 4%. These are true Minnesotans, the 4% that said winter is their favorite. So nice to see that. So I'm going to move out of that. Once again, thank you so much to our panelists. And it did remind me, I meant to do this at the beginning. I want to make a land acknowledgement. And so I want to thank Dr. Stately for doing that. And so just a reminder, as we talk about people having a home and having a place to live, that when we look at our Minnesotans across the state, we are in the land of the Dakota and the Lakota people, the Ojibwe, Anishinaabe, and the Sioux, And we need to recognize that and appreciate their care and their concern for the land, and recognize kind of our role in what's going on. And so I just really, I'm going to try to be more conscious about starting with land acknowledgements when I have meetings. I need to practice a little bit, but
Okay.
I think that's wonderful.
Make an effort. Also, the Ho Chunk, they had a little tiny part down in
Okay.
southern Minnesota.
So you can coach me. How's that? So
Cool.
I'm
Happy.
going to share my screen, and we're going to talk a little bit about our legislative priorities. So start by saying Minnesota operates on a 2-year legislative timeframe. So when you hear about the biennium, every 2 years, the legislature has to figure out what its budget is. So unlike the federal government, they're like our home. We need to have a balanced budget. We can't spend more than we have. So in the first year of the 2-year period, and we're in the first year right now, it runs from July 1st of 2021, 2020, I'm trying to think what year we're in, right? From July 1st of the 2021 to June 30th of 2023. And so the legislature has to figure out what a budget is going to be for the next 2-year period. And when you think about a government shutdown, or you think about a deadline, if the government doesn't do that, if the legislature doesn't do that and have a bill that the governor signs, as of June 30th, there's no appropriation for most of the programs that the state runs. Emergency things will continue, essential services will continue, but that's our ultimate goal for this year, is to figure out that budget for the first year, for those 2 years. They can come back next session and fine tune that if new issues come up or they see how things have been spent. But that's the big focus for these 2 years, is figure out a budget, what things are going to happen. It's complicated because of everything that's going on with COVID. So they have a constitutionally set date for the adjournment of the regular session, which is May 17th. And the things that they're really looking to get done between now and then is a lot of COVID specific legislation. We have legislation around renters and homeowners and landlords and small business and all kinds of health issues and childcare providers. So a lot of issues around COVID specific legislation. When they're figuring out that budget, they need to figure out how much money is coming in, and that's tax income. So some of our income comes from specific designated funds, a significant amount from block funds and other support from the federal government, but the remaining amount comes from corporate tax, income tax, sales tax, and so they figure out a tax bill. And then they figure out how they're spending. So if we are going to figure out our budget, we need to figure out how much we're spending on schools and on transportation and on human services and a whole wide variety of things. And so they figure that out. And then they're policy bills. So they don't need to pass policy bills. It's not constitutionally required. There won't be a state shutdown, but there are a lot of things that we know that are working well and things that we really need to change. And so that will be part of what happens. And finally, a bonding bill. And so those of you that have been in our network for a long time, I've heard a lot about bonding. That's where the state is selling bonds in order to fund projects. Most of the discussion we've had around bonding is about housing, and we'll talk about that in just a moment. But the interest rates are low. The state has a good credit rating. There are significant numbers of shovel-ready projects around the state. That's true in transportation and all kinds of other things, but we're really looking at housing when we do that. So that just gives you a big picture of where we are. There are a number of deadlines, and so you haven't gotten a lot of action alerts yet. They can be, you'll get much more of those as we approach the end of the session, because right now all the committees are hearing policy bills. And so should there be changes in the law? And we will have some of you have gotten notices that your representative or senator is on a key committee. We want to make sure they hear from you before the committee hearing. But as we move along in the session, we're really going to be having significant discussions about spending on safety net programs, about all kinds of things. And so we'll talk about some of those in a minute. So you'll be getting those action alerts much more frequently after about the next 2 weeks. So what are the issues that we're working on? You heard Blair, so very timely, talk about the very real needs of the shelter system in Minnesota. It's significantly underfunded, and that's really been made clear during the pandemic. one of the great things about the emergency services program is it's incredibly flexible. And so people, providers, communities are able to say, what are the needs that we have? What are the things that we need to address? And so you have a briefing sheet along with the link to this. If you registered for Dan the Hill, you got an email with all of the information, all the briefing sheets on these various issues. If you joined us through a link that you just got on our email, if you go and register, we'll be providing those to you tomorrow. So there's more information on that, but the emergency shelter services program allows spending on food or transportation or hotel rooms or more bedding or vaccine advocates or whatever seems appropriate. And so it really allows groups to look at what their needs are. The funding is significantly abominable. I mean, I really don't know what else to say. And so we're working with a number of groups, Minnesota Coalition for the Homeless, part of the Homes for All Coalition, to say we really need to have in our base budget every year significantly more money for this program. The shelter system is what saves lives. It's what allows individuals and families to have some stability before they can move into an apartment, before they can have other, really find their way to where they want to be. The average shelter stay is probably about 3 months in Minnesota. And I think that shows that it's working because they aren't longer. It wish were shorter. We wish we didn't have those needs. We also know from looking at other states that once there's no longer a moratorium in effect for evictions and for foreclosure, that the numbers of people experiencing homelessness has gone up. And so we have a number of Minnesotans, significant numbers of Minnesotans that are behind in their rent, that are behind on their mortgage, they're having difficulty making basic utility payments. And so there are two bills that we want to make sure you talk about when you meet with your legislators, and this is one of them. We really need funding for the shelter program. That $15 million is not a huge amount of money when you look at the state budget, you look at the things that we're spending money on, and it would make such a significant difference in the lives of many, many Minnesotans. So you'll see that. And the flexibility is really something that allowed not only shelters to respond to COVID-19, but it would really allowed them to say within the context of vaccines, as you've heard about tonight, what will work for our community? What will work here? What are the things that we need to do? So a briefing sheet on that. Each of the briefing sheets has the numbers of the bills. It has the names of the chief authors on the bill, as well as the authors at the end of that. So for example, for this bill, the chief author is Jamie Becker Finn in the House and Senator Utke on the Senate side. But if you read through the end, it also says everyone else who signed on to the bill. And so I want to make sure you look at those before you have your visits, because if one of your legislators is a co-author and has signed on, we want to make sure that you thank them. So the bottom line is this money is investment in people, that shelters save lives and they create a bridge to stability. So please talk about that bill. I have a couple other things on housing here, which you'll probably be hearing from us about later. And we want you to have some flexibility within the conversation to see how things go. So I just want to flag these for you. We continue to need COVID relief. I talked briefly about people having difficulty paying some of these basic bills. The CARES Act with federal money that allowed housing assistance for mortgage, for rent, for utility payments ran out in December. We're getting a pretty decent amount of money from the federal government that will help with rental assistance, but it's limited to rental assistance. So we're still going to have a number of challenges. Bonding, something we always talk about. I want to thank all of you who were on this call that answered our action alerts, and we heard from many of you that did, and what your elected officials were saying, that you answered our action alerts during the session, and during the first special session, and the second special session, and the third special session, and the fourth special session, to make sure that people were hearing about the importance of bonding for affordable housing. And the legislature approved $116 million in affordable housing. But that's not enough. We need more. you can look at any community around the country and around the state, around the country probably too, but around Minnesota, we have a real lack of affordable housing, and we need funds for emergency shelter as well. So feel free to talk about that in your meetings, or feel free to wait until later in the session. Probably the thing that we talked about that we got more notice or more questions about than anything in a long time was our bill to create micro units, which would be a regulatory change. And I think you're probably going to be hearing more about this as we go into session for next year. This comes out of a model from a nonprofit called Settled, which is based on the concept that a lot of approaches to housing look at the phrase housing first, that we need to give someone a place to sleep and then we can work on their other issues. And this comes from research out of the University of Minnesota that looks at what are people wanting, people who are experiencing homelessness, what are they really missing? And when you look at people who have chronically experienced homelessness, if you look at the federal definition for that, that's someone who's been homeless for more than a year, or someone who's had repeated episodes of homelessness over a period of time. They are missing relationship and community. And some of these people have had really difficult challenges in their lives, physical abuse, sexual abuse, not just in childhood, but into adulthood. And their model would allow places of worship. So this could be a church, a synagogue, a mosque, any other faith community, to create a community, think like of tiny houses. We're using the word micro unit. Tiny house is kind of a term of art. But they would be on the property of the religious organization. They would have space in that facility, in the church or a separate common building, or in the synagogue, for laundry, full showers, bathrooms, private rooms to meet with a caseworker or mental health professional or a lawyer. They'd cook together, they could gather together. And so the communities so far that are looking at this are saying, we can make room. That's not a recognized form of housing right now, the micro units, partly because they are on wheels. The way that the model is looking at them is they're created by different faith communities and then brought in on trailers. So that makes them an RV. They're not lawful permanent housing. There are also some issues around the fact that they aren't fully plumbed. So they have a compostable toilet or some other kind of dry toilet. Whoa, and here you see a picture I advanced by mistake. But you can get this is their prototype. So we've been working on a bill to do that. And the key aspect of this community is really what they call missionals. The legislation talks about designated volunteers. So we have people who are housed, who have been housed and unhoused voluntarily working together. So people are intentionally choosing to live in one of these tiny homes, along with people who've experienced homelessness, in order to be a faithful presence, in order to create a community that really envelops them and welcomes them and accepts them. And so we have a bill. Those of you that are in districts with people who have been involved in that, you'll hear from me about these. But just to give you a sense of this, I'm just showing it, although we're not asking you to talk about it now, because I think this is going to be something we'll be working on more next year. But here you can see the model. And then I also included just a picture of the inside, so you can get a sense of what the homes look like. And they're beautiful. The concept is beautiful. So you'll be hearing more about that. I think you'll hear more about that. Fees and fines. This is a really good example of what we talked about earlier, where is the system broken? Is the system working the way it was intended? Did people really stop to think about how the system might impact people that aren't like me? And so there are two aspects of this. If you talk about both bills, there are sheets on both of the bills. That's great. If you just want to talk about the driver's license bill, which I'll talk about in a moment, that one seems to be moving along and has a greater likelihood of passage this year. But quite simply, if I'm driving down the road and I get a speeding ticket, I live in Ramsey County, my ticket's $40. The state automatically imposes a $75 surcharge on top of that. In Ramsey County, there's a $10 fee for the law library and a diversion program and a couple things. But it means that for most Minnesota families, for most tickets, regardless of the local fine, the total is over $100, which is a real burden for a lot of individuals and households. The law allows the municipality, the court, to waive any or all of the local fine or require community service, but it has no authority to do that for the $75 surcharge. And that surcharge is just going directly into the general fund for the state. It's not targeted for any particular purpose. And so you have Minnesotans that are unable to pay a basic fine because good example, I had a broken taillight because I couldn't afford to fix a taillight. And now I get a ticket because I didn't fix my taillight. And so we were really asking for authority, for courts to have the authority to waive those as well. The next piece is that if I can't pay that fine, my license gets suspended, not because I'm a danger on the road, not because I'm a reckless driver, but because I'm unable to pay. And so this has huge impact on someone's financial situation. First, I have to decide, am I going to drive without a license? My license is suspended. Am I going to continue to drive? Many of you are from parts of Minnesota where that's not really an option. I need to drive. I can't support my family if I don't do that. Or if I choose not to drive, I lose my means of employment. If I drive and I get pulled over for driving with a suspended license, I get a ticket for that. If I do that again, I get a ticket for that. If I can't pay that ticket, additional charges and late fees and things continue to accrue. If I have any suspension of my driver's license, my insurance goes way up. And if I don't have a license, I can't be insured. So there are all kinds of ways that this really plays out in a systematic way that is very harmful to low income people, which means a really significantly disproportionate impact on Minnesotans of color. So there's two separate bills you'll see in the briefing sheets. One is the bill about allowing courts authority to address that fine and reduce or waive it. But the driver's license suspension bill has gone through all the committees in the House. In the Senate, we need a hearing with the Judiciary Committee. And so any of you that are having visits are going to get an email from me this weekend with just some specific things to point out. So it's passed through committees in the House. It passed through the Transportation Committee. On the Senate side, it needs to be heard in the Judiciary Committee. That's Warren Limmer's committee. So those of you that are in his district definitely will hear. But this is an example where we want you to talk to legislators about, please support this bill. And when they say we support it, we want you to say, great, can you make sure and push for that bill to have a hearing? So saying I support it or saying, that's not in my committee, I'm not on that committee, isn't enough. We want you to make sure to talk to folks about the importance of getting action to be taken on this bill. So that's that piece. Driver's license suspension, I guess here you see it again. And then you see that if this happened, if the bill were to pass, the number of Minnesotans whose licenses would immediately be reinstated, 33,000 Minnesotans automatically would have their licenses reinstated. So, when you look at this, you look at the impact on people who are really struggling economically. You look at the impact on communities of color. You look at the reality of living in much of Minnesota. If you don't have a driver's license and you're not able to work, this is a very clear example of the system being either broken or the system being created without concern or regard for its impact on many of the people in our state and how that happens. So we've worked on this before. A number of you have told me in the past, you've had really good discussions with your legislators about it, but especially on the Senate side, we really want you to push on the Senate side with Republicans to get a hearing on this bill. It's really, really important. Childcare. If you end up only talking about the shelter support and the driver's license suspension bill, we understand that. But we're hoping some of you can get to childcare, and a few of you have already reached out to you because you're really in key districts. And we're going to move childcare up on your list a little bit and say, we need you to talk about childcare, and then you can pick which others you want to talk about. But, if I am a parent, I need to have childcare I feel comfortable with if I need to work. And Minnesota has not kept up with much of the country or the federal recommendations, and looking at how do we provide affordable, accessible childcare in Minnesota so parents can move families into economic stability. I need to have that available to me, and I need to feel comfortable with that. So Minnesota has, like many states, a child care assistance program. It provides support for families based on their income. There's a basic sliding fee. So some families have all of their costs covered. That decreases as your income increases. And so across the state, this is the largest program serving infants and toddlers. It provides support for 15,000 families and just over 30,000 children. So if I'm engaged, if I'm participating in the program, I need to find a provider. And so if I'm a provider, whether that's a center, whether that's someone providing childcare in their home, I get reimbursed from the state for providing this service. The federal recommendations are that that reimbursement rate be set at the 75th percentile of the market in my community. So that means if I'm a parent, I can look around and I would probably be able to, I should be able to choose from 3/4 of the providers in my area. I would have enough money to 3/4 of them that reimbursement would cover. But that's not where Minnesota is. We used to be there. In 2003, we were there. That's where the federal government says we should be. But currently, Minnesota is at the 25th percentile based on a 2018 survey. So there's two problems with that. First, it makes it unlikely that providers are going to want to go into providing childcare. But another real challenge is if I'm a provider in a location where there isn't a glut of providers. Much of Minnesota is really in a childcare crisis, especially for infants. I can choose whether to take someone who's participating in this program where I'll be reimbursed at the 25th percentile. And I want to make sure that's not 25%, but that means if I went out into the marketplace, that would reimburse about 1/4 of the providers in my locality. So if I'm a provider, I can take that rate of reimbursement, or I can take reimbursement at or above the 50th percentile. And if there's really a shortage of childcare, I can probably charge more. So it makes it less likely that these families that are already at the lower end of the income scale, that they can find childcare to take care of them. In addition, we have 2,900 families that are currently on the waiting list. So these are people who would be eligible for childcare assistance. They could use this assistance to either go to work or in many cases go to school and receive training or the education they need in order to better provide for their families, but there's simply not funding available to take care of them. We have federal funds in the bank right now. We receive them from a child development block grant that would allow Minnesota to move to the 30th percentile for the next 3 years. So I just want to say that again. We have enough money in the bank right now from the federal government that's just sitting there unused that would allow Minnesota to get to the 30th percentile, which would not be nearly as much of an increase what we want, but would be an improvement. We have just over $500 million coming to Minnesota as part of the relief fund or the relief package that President Biden will be signing on Friday. And a significant amount of that would be able to be used both for provider rates and to address the waiting list. So our message, you can talk about the importance of childcare. Our message really here is spend the federal money. So this isn't even go into Minnesota's general fund. This is spend the federal money to help these families and to help these children. So there's a briefing on that, so you'll see that. So we support increasing provider rates to help providers stay open and move families off the waiting list. Your voice matters. Okay, I just can't say this clearly enough. No matter how articulate or well-informed or how much data I have and I go in to talk to a legislator, that's nothing compared to when you go in and talk to a legislator, not only because you can vote for them, but because you represent their community. And when you go in and say who you are and that you're part of the Joint Religious Legislative Coalition, we recommend that you also identify your faith community. It's clear to them that you are representing a community voice. You're a resource to them about what's going on in their community that they don't necessarily hear. It's really important that they hear from you. Faith communities have a really unique perspective in cases like this, especially when we look at some of the groups that may not be as vocal. You see people when they come in for emergency assistance. You see them when they're really struggling. And so for you to tell those stories about what you see at the food shelf or where you may be volunteering or whatever it is, those are really important stories. And those make a difference. I think sometimes this isn't really what my job description is listed as, but I think sometimes it's my job and your job, the whole job of the JRLC, is to have legislators who are looking over here at the spreadsheet. Here are the dollars and here are the money and here are things. I want them to look at the people. I want them to be reminded that these are very real people. This is why your action's important. This is why you need to do. And that's what you can do. That's your role. That's what you are so effective at doing. And that's why these visits are so important. So I want you to share what you see in your neighborhood, in the community, and in the places you volunteer. So you're really not going to keep hearing from me all night long. I'm going to let you hear from Joan for a minute. But for those of you who have never contacted a legislator, I just wanted to pull this up. So you can see my cursor, I think here. So you can just do a Google search, find my legislator, or this is in a bunch of our email alerts that we send out. But you see in the middle of this page, about halfway down, enter your address, city, state, zip code. You just type your address in and it'll say, here's your senator, here's your state representative. It does the same thing for the federal offices as well, but that's all you do. So then once you have your name, what are you going to do with that? You're going to go online. I happen to pick Jamie Becker Finn because she's a chief author on one of our key bills. And so you can see, here's her name. You can call her number. You can email her. If you want to set up a visit, this is the name of her legislative assistant down here, Anna Berging. So you can call and leave a message. Anna's not going to answer during a regular session. She might, but she'll probably say, please, you can leave a message, or you can send an email to me and she'll leave her address. And I just want to say one more thing. When you look that up, I included Representative Howard here. He's the lead author in the House on the shelter bill that we spoke about. And he not only has his name and his district number, he has this assistant majority leader. Okay, that means they're in leadership, and you can say you're a leader in the caucus. This issue is important to us. It's really vital that you use your leadership role in order to make this a priority and make sure that it's heard. So my last phrase here, make justice your aim. I'm going to steal from Reverend Slack here, who I hope you found him to be a modern day prophet in the same way that I do. But I loved him saying all of us can be prophets. All of us can make sure that the will of our Creator is heard, that it's proclaimed, that when we're talking about justice, that those voices are heard. And so let's make justice our aim for all of us. Let's all try to be those prophets in the session as we move forward. So some of you are a little intimidated. I saw from the poll that some people were nervous. So before I turn it over to Joan, I'm going to have you go back to our board chair. So Rachel happens to be an expert at making calls and visiting legislators, and I asked if she would be willing to do that. So I'm going to stop sharing my screen here, and you are going to see how easy it is for someone to do this. So Rachel, are you ready?
Ironically, I don't know if I'm an expert. I have, I'm always, behind the scenes on these things. So I love it because I haven't actually called my representatives a ton. But Anne's not wrong in that it is easy. So we just looked up just before I used the sheet that Anne had done. So we found Dave Pinto is the district. He's one of the reps that represent me in St. Paul. So we're going to call him. He probably won't answer because, it's 8:30 at night and I'm calling his office. But
so we can see if he answers.
Yeah, we're going to see. And basically, if not, I am going to leave him a voicemail message, and I'm going to share with him exactly why I'm calling and what I care about. And it's ringing right now. So we'll see if it goes to voicemail. But so I'm super excited. This is super easy, and you can always look up and email and leave voicemail messages for whoever, but showing up in person is always fantastic. But note, we are always happy for whatever you do to reach out to them and connect with with our agenda. So it's about to beep.
Okay.
Here we go. Hello, Representative Pinto. My name is Rachel Babbitt, and I live in your district. I live on Berkeley Avenue in St. Paul, and I am super excited to say thank you for supporting the emergency shelter bill that would give $15 million to emergency support programs. I deeply care about housing and emergency shelter as a person of faith. I'm calling on behalf of JRLC and the fact that I'm actually the JRLC board chair. And I believe that everyone deserves a home. And so I just want to say thank you for supporting that. And if you would like to call me back or connect with me, my phone number is 612-240-0558. And I just thank you so much for your support for justice issues. Thank you. Bye-bye. It's that easy. You can do whatever you want. You can say whatever you want. And we just ask that you share that you're with JRLC. And these people work for us. So call them and hold them accountable and ask them to support our issues.
Thank you. Okay, we are now going to turn it over to our statewide organizer, Joan Miltenberger, and I hope Joan's there. So she's going to talk a little bit about when you have these meetings, what's going to happen. So welcome, Joan.
Thank you. I am definitely here, and it's been a great day because I have heard from so many of you in the last couple of days, actually the last week, about your meetings that you've set up already with your legislators. So that's what we want to focus on right now. This is like, as someone said in the Q&A, this is boots on the ground now, like taking the inspiration, taking your faith and putting it to action, really moving forward with creating relationships and making sure that you are advocating on the issues and the people impacted by those issues too. So a couple of things I want to talk about is what makes an effective meeting. And I think some of this is actually quite common sense. We all know that if we're in a good meeting, that meeting was well planned. There was clarity about the goals. We knew the participants. We knew, and by participants, that's both, we know each other as advocates. We know people in poverty that we walk with, and we know our lawmakers and other community partners like Deb and Blair, and Dr. Anthony and Reverend Slack as well. So we want to know the issues well, and we have great resources. We have these issue briefings. We send out every couple weeks email updates, with often have a segment or a testimony on them related to an issue. And part of a good meeting, obviously, is exchanging information. It's not simply sort of one-way conversation, but having a dialogue, but around the issues that are important to JRLC and the people that we are advocating for. And then certainly a good meeting means that we don't get off track. We may enter an interesting conversation, but we need to make sure those meetings aren't hijacked by veering off on totally unrelated topics. So when you're preparing for, quote, a regular day on the Hill for JRLC, you're usually meeting together with folks in your district, and you're doing some prep work before you head to the Capitol. And that prep work is really important to lay the foundation, because you're looking at who's the legislator we're meeting with. What do we know about him? Does anyone know him directly or her directly, or others? Do we understand what bills this person has authored, what their interests are? And certainly if you have someone in your group that already has those relationships, you want to make sure that they share those to the total group as well. And then what do we know? Is there someone within our group who can really speak well and share a personal story about maybe their experience of homelessness or loved ones, or how they hear stories at the shelter where they work or volunteer, or the food pantry where they're at? So how do we take the relationships that we are building in the community and our own experiences and make sure we're bringing those to the legislators? So that's a key part, always the stories, not just the exchange of information. And then certainly to have the issue briefings either with you, you can send those in advance to your lawmakers, you can send them as a follow-up, or if there's that ability, you can also share them during a meeting via Zoom. And I just want to mention, I've seen a lot of emails the last number of days, and there are a number of groups who have scheduled meetings with lawmakers, but they are having the first 20 minutes with the advocates in their district. And so that's a good time. That's one way to do that prep is immediately before, so you can include that time in your Zoom link. And that time is really important too, to figure out what sort of opposition, what might we hear, or what are those same old lines that we hear from lawmakers? And how do we not be defensive when we hear the same old line, or someone says, well, I just, that's too much money, but how do we have a solid response about this is costing less to offer opportunity for people who need housing, who need healthcare, who need childcare, that the community does better, and it's obviously less expensive in the long run when we have equity through these policies and programs that are committed. So certainly knowing in advance, how do you have a couple statements ready when you might feel a wall is being put up? And you might even think about this, well, when I talk to my relatives, sometime I have that experience. So what do I do to prepare myself for that so that you don't stop the conversation, but that you really continue the engagement? Because what we're talking about is not just one meeting, but really building a relationship that may be a number of years, or for some people who have been in the House or Senate for 10 years or more than 10 years. So that's important to know, to let the legislator know that you are observing what they're doing. You're maybe following some bills, if you get into that much of the nitty gritty of it. So the meeting itself, I do want to mention that we sent out 3 documents, and one of those was a 2-page handout called District Meeting Hints. And this gives some step-by-step preparation you can do, some common sense things to prepare for during the meeting, and then also following the meeting. So we've already talked about knowing who may be talking during the meeting, and it always helps to have one facilitator. That could be a district leader or another advocate, someone perhaps who has worked with this legislator before. So making sure there's one person who's keeping the meeting on track and making sure it doesn't get hijacked. Not to be negative, but to be realistic about what happens in meetings. And then again, to choose a couple people to talk about the 3 issues, if you have time for all 3 issues. And then certainly to have someone take some notes so that you can let us know what is happening in that meeting. That is really important. And I will say, especially for Anne, because when she's following up with a lawmaker and she knows, yeah, District 23 talked to, and I forget the name of the rep and senator down there, and boy, Anne, this is what we heard, and this is the challenge we heard, or you wouldn't believe how supportive they were. And we asked them how we could help them, like move this even further, not just be supportive, but talk to their colleagues in the Senate and the House too. Like just move, help them to take more action themselves. And then certainly you're asking for their support. And at the end of the meeting, you're thanking them. And also perhaps that might be a time, if you were in person, you might be leaving them with something, or you might be saying, I'm going to send you our county fact sheets. They'll be really helpful for you. And I'll just include a note with that as well to share some of my experience. So I just want to highlight one more thing. I know we need to move on. There is also a legislative meeting debriefing sheet. And this was in your email this morning. And again, that is very helpful for us, both in meeting with legislators, but helpful in providing support and resources for what you're doing already. I just want to say it has, my hope has just been the emails that I've received the last week about what advocates are doing in the community, the amazing emails they've written to legislators, you're doing all the right things, but if you need support or help or tips, please give me a call, or rather I should say email is best, and then I can call you back if needed. Or if it's a specific policy issue, please let Ann know as well. So I know we're at time. I better end it up. But thank everyone for being here, and the panelists as well.
Thank you, Joan. So Joan loves to hear from you. That's, her job is talking to people on the phone and doing emails and eventually getting out on the road. So we're looking forward to that day. But that's what her job is. You're never bothering her if you contact her. Is loving to do. So I want to just do a couple really quick things. Yes, the debrief sheets are really important, and you'll be getting a survey, monkey survey, Monday or Tuesday of next week. We'd like your feedback not only on the program tonight, but also on how this went, us organizing our legislative visits in a very unique way. I want to thank Sue Watlove Phillips with Micah, who shared, because you can't be up to date on everything all the time. I have not been paying close enough attention because I've been getting ready for this event, that there was a federal law, homeownership assistance law passed, $10 billion for homeowners. I talked earlier about the money coming for rental assistance, and this is for homeowners. So that should be signed tomorrow by President Biden, and so we'll be watching that. I would love to say that between those two bills, we'd be having enough at our state to address Minnesotans who are struggling, but I'm reluctant to say that until we get more information. But thank you for raising that. We work a lot with Micah. The briefing sheet, several people asked about, would the slides be available? And we can probably make those available. That won't be my immediate priority in the next few days. But if you are not registered for this event, and it's great that you're here if you haven't officially registered, but if you go to our website and register, you'll get an email with detailed briefing sheets on all of those. And so the sheets talk about what the name or the subject of the bill is, what the numbers of the bill are. They talk about their setup. So we give some background. So you have some, interesting information. They talk about why we need to have a change, what the JRLC's position is, and then key talking points. We also then list everyone who signed on. So if they're look at them ahead of time before your meeting, so you can say, thank you, representative or senator, whoever it might be, for being supportive of that. But they give you what you're going to need to talk, not only knowledgeably, but really passionately about issues that we know that you already care about. Joan referenced very briefly the county fact sheets. Every 2 years we do for each of the 87 Minnesota counties, a county fact sheet, and it looks at the reality of economic stability. So how many families are living in poverty, households are living in poverty, what percentage of children are eligible for free and reduced lunch. We added 2 new statistics this year of those people who are renting in the county. How many are paying 30% or more of their income for housing, which is considered cost burdened and recommended against, but that's kind of the level you look at cost burden. And what percentage are paying 50% or more of their household income in rent, which is severely cost burden and obviously impacts their ability to provide for other basic needs. But those are all on the website under our advocacy resources, county fact sheets. You look at them by county. How do we know if, oh my goodness, I wrote that messily. Oh, how do I know what issue? How do we know what issues we're going to talk about? We want you to talk, we want you to build a relationship, right? Want a discussion, but we want you to say, especially on the Senate side, we need a hearing. That driver's license suspension bill is really important to make sure that House members are hearing about that as well. That's going to be in the omnibus bill on the House side. And we need you to talk about the importance of funding for shelters, that emergency support program. So that's what we want you to talk about, unless we're separately reaching out to you and saying, in your district, we need you to talk about the child care assistance program. So there may be 8 or 10 districts we're doing that in. Some of those you've already heard that. And if you get to child care assistance, or if you have great stories about that, it's wonderful if people hear those. Finally, we had someone in the comments say, the program's wonderful, but I'd really like to hear more about what kind of language do we use when we talk about Democrats and Republicans? Like, what are the key phrases? If I want to find a veteran to come to our meeting, how might we do those things? This year, for the first time, and now I'm running us over, so my apologies. This year, for the first time, we've started having a number of webinars on a significant number of things. We had one on how the state budget works. We had one pre-Day on the Hill. And so this is a really good topic for that. And so we'll be looking in the next couple of weeks at just putting one together. And some of them are larger, some are smaller. The smaller ones in some ways are nicer because we really have a discussion, but I appreciate, I think Lorraine sent that. So I appreciate your comments and we'll work on that. So with all of that, I'm going to turn it over. We have for our closing prayer, Pastor Pfaff. He is from Worthington, Minnesota. He's a Presbyterian minister. And so I would like him to offer our closing prayer. And then I just have a few closing words. So Pastor, are you there?
Yes, I'm here.
Okay, thank you.
It's been a privilege to be here. I'm a first timer, and so I appreciate all this input and the privilege of leading us in a closing prayer. But before we go to that, I want to take us back to that foundational passage from Isaiah. Verse 17 was the key verse, but what happens prior to that verse is also important. The prophet here is declaring that God is saying, and I'll put this in the vernacular, God is saying, when you come before me, I'm really not interested in your empty religious rituals. In fact, they annoy me. I reject them. What I really want you to do is take care of each other. And that reminds me of a quote from Pastor George MacLeod out of my Christian tradition. This unconventional pastor of the Church of Scotland calls us to raise the cross high at the center of the marketplace, as well as on the steeple of our churches. And he would urge us to recover the claim that Jesus was not crucified in a cathedral between candles, but between two thieves on the town garbage heap at the crossroads that were so cosmopolitan that they had to write his title in 3 different languages. At the place where cynics talk smut, thieves curse, soldiers gamble. Because that is where Christ died. And that is what he died about. And that's where we should be. And that's what we should be about. I think that quote can ring true for all of us, whatever our faith tradition, and to whomever we pray, to whomever we consider to be holy. So join me in prayer. God, as we go forth from this day on the hill, help us to be clear about where we should be in solidarity with those who suffer, in solidarity with those who use their power for good, including legislators. God, help us to be committed to be where we should be and what we should be about. Making justice our aim, empowering possibilities and stability so that everyone can have the dignity of having agency to contribute their best. God, we're grateful for the insights and the inspiration of tonight's leaders and fellow advocates. We are grateful for your presence tomorrow morning as we continue to stand alongside those who suffer. So, Spirit of the sovereign God, be upon us who would be your prophets. Bless us with compassion. Bless us with hope. Bless us with wisdom. Bless us with courage. And with these blessings, empower us to be faithful servants of your will, good stewards of your creation, and genuine lovers of all our relatives. Amen.
Amen. Oh, thank you for that lovely prayer. Thank you, Pastor. Thank you for all of you who are on the call. We are so proud to be involved in this work with you. I want to encourage you to reach out to Joan or to me with questions that you have. We want this to be a partnership. We want to hear what's happening in your community, and that's really helpful to us. And we want to help you build a relationship with those other your representatives in that area. I want to thank all of our panelists, everyone who is part of the program this evening. It's quite something to put together a program like this, and we're really pleased that the people we reached out to were very willing and very interested. And I feel really blessed for the many partnerships and collaborations and connections that we have. So I just want to say, have a wonderful evening. We look forward to hearing what happens in your legislative visits. And this isn't a one day. We want you to continue to be contacting your legislators throughout the session, after the session, before the next session. And think about ways to do that. My favorite was when I talked to someone about how to do that. Someone said he was going to talk to his legislator when he saw him at the beginning of the pheasant opener. And I thought that was one of the most Minnesotan ways to connect with your legislator that I'd heard of. So I really encourage you, once we're gathering in person again, to invite people that are representing you, invite your senator and your representatives to a potluck dinner at your faith community, to the places where you volunteer, to see the people whom you're serving, and really get a different perspective on your community. Get to know them, have them get to know you. Email, call, invite, show up, as our board chair just stated. So just blessings on all of you. Thank you so much. And thank you for your work. We look forward to continue to work with you all. Thank you. Good night.